Hi, this is Sarah McClellan with Pixels and Pills, and we're here in Philadelphia at the Digital Pharma East Convention. I'm standing here with Mr. Ian Talmage, who is the Vice President of Marketing from Bayer-Schering Pharma. Let's get a little bit of background about, a short history of your career and what brought you here today to the conference.
A 33-year veteran of the pharmaceutical industry in marketing, principally on the international side, global marketing, and fairly fortunate in having worked with some fantastic drugs that have produced great results and great benefits to patients.
So you did the keynote speech this morning, and we had a little bit of a departure because you have quite a personal story and personal connection being a cancer survivor, and you spoke about how this changed your perspective for what you do in your place within the industry. Can you, talk a little bit more about that for us?
Yeah, I think that I spent a lot of time in my early career talking at patients, talking at doctors, talking at the healthcare profession. And when I got to the point of actually being in the environment of major ill health, I realized that I needed support. I needed something that's going to help me to handle the fear, the anxiety, and understand what I could do actually to help myself. And it created much more emphasis towards dialogue, and that emphasis moved me much more towards looking at the value that social media could provide in enabling the pharmaceutical industry to be part of the solution, together with physicians, together with rehab specialists, together with payers.
Are there a lot of people within the industry and, in the position to give support to their patients who are online? Like, where are they? What sort of channels are they using to connect directly to their patients to, as you said, be the support that they need, to offer support about the fear, about, getting the treatment, learning about new treatments, being able to connect with their healthcare providers or people at the drug companies? What channels are people using to connect with patients?
The channels, I think the channels include YouTube, Facebook, the internet sites, Twitter. All the conventional channels are there. The challenge, I think, that the industry has is how to overcome some of the limitations, regulatory limitations, on what can be said, how it can be said, what we need to do with information we receive, how we involve ourselves in conversations that may go beyond our label. So the intent is there, and the intent is very high within the organizations, but we've got to find the means by which we can overcome those boundaries that have been laid down by regulators. One of the things that I think is fundamentally important, certainly from my perspective, very valuable, were the patient organizations who could speak to what they felt was necessary to support patients, not limited to particular products, but everything from the way of life to the diet to the therapy to the rehab. So we're in there, we use the channels, but we've got to perhaps grow up a bit more to be able to participate in real dialogue rather than what is euphemistically called active listening.
Is there anyone in particular during this conference you're looking forward to hearing speak, someone who you feel like is making strides with innovation with this particular subject?
I don't think there's an individual per se. One of the values that I get out of this is the overall opportunity to meet people who have a like mind. I think they all want to get to a better place. There are people who have the technical skills, and there are those that have got the innovative value and can stimulate the thinking of people like myself. So nobody in particular. Social interaction is going to be important. That's what it's about.
Well, thank you so much for speaking with us today. We really appreciate it, and have a good time at the rest of the conference. Thank you very much. This is Sarah McClellan with Pixels and Pills signing off.